Yes. Hello everyone. In this section, I'll discuss about the anatomy of pharynx. Coming to the objectives, first we want to recognize the boundaries and divisions of pharynx. Then we want to list the structures of each group of pharyngeal muscles and their nerve supply. Then in the end of the section, you will become familiar with the key structures of pharynx in both sagittal and coronal sections. Okay. So here what you're seeing, this is the base of the skull. Okay. This is the see, this is the anterior aspect. See, this is the posterior aspect. Okay. See, this is the alveolar process of the maxilla forms this upper jaw. This is the hard palate. Okay. It's the hard palate. This bone from here to here, this is the palatine process of the maxilla. Then here, this bony part is the horizontal plate of the palatine bone. These two bones forms this hard palate. Okay. Here you can see this is the opening. This is the posterior nasal aperture or choane, which leads anteriorly into the nasal cavity and leads posteriorly into the nasopharynx. This yellow shaded area, that is actually the sphenoid bone. Okay, this is the medial pterygoid plate of the sphenoid. This is the lateral pterygoid plate. This is the pterygoid hamulus. This medial and lateral pterygoid plate collectively, that is called the pterygoid process. Okay, so that is the sphenoid bone. See the blue shaded area, this is the basilar part of the occipital bone. Anterior to that we'll get here, this is the cartilaginous part of the pharyngotympanic tube or the eustachian tube or the auditory tube. Okay. Yes, here this anterior part of this pharynx. So pharynx is a fibromuscular tube. Okay, anterior part is incomplete. Okay, because it has communications towards this nasal cavity and towards this one, that is to the oral cavity. Posteriorly, it is complete and is made up of muscles and the fascia. There is a fascia. Okay, see in the upper aspect of the pharynx. Okay, that is called the pharyngobasilar fascia. This is the attachment of the pharyngobasilar fascia to the base of this occiput, that is to the pharyngeal tubercle, and the sides of the petrous bone to this medial pterygoid plate. Okay, this is the pharyngobasilar fascia, which connects the fascia, which attaches from this base of the skull towards the upper part of the superior constructor muscle. Okay. Then here, see, this is the posterior nasal aperture. From here starts the pharynx. Okay. Then the parts of this pharynx. Okay, see, this is the sagittal view, anterior aspect, posterior, superior. Okay, so pharynx extends from this base of the skull. This is the part of the sphenoid bone to the lower of this cricoid cartilage. See, this is the cricoid cartilage at the level of the C6. Its length is some 12 to 14 centimeter. Okay, so this is the anterior nasal aperture. This is the nasal cavity. You can see these are the conchae. In between the conchae, the spaces are called the metatarsus. Okay, then this nasal cavity leads into this pink color area, that is the nasopharynx. Okay, that is the nasopharynx. Okay, see, this is the oral cavity. Okay, this is the tongue. Okay, this oral cavity leads into this area. This is the orange shaded area. This is the oropharynx. See, this is the epiglottis. This is the thyroid cartilage. This is the cricoid cartilage. Okay, this is the laryngeal inlet. Behind the laryngeal inlet, you can see this blue shaded area. That is the laryngopharynx. So divisions are, this is the nasopharynx, this is the oropharynx, and this one is the laryngopharynx. So nasopharynx lies behind the nasal cavity. It's the passage for air only. This is oral cavity, and this nasal cavity is separated by this hard palate. Behind that we'll get this structure, muscular structure, that is the soft palate. It's made up of some 5 muscles. Okay, then this oropharynx is a passage for both air and food. Okay, see, this is the larynx. Okay, behind that we'll get the laryngopharynx. Okay, the laryngopharynx is a passage for food. Okay, so these are the parts of the pharynx. Then coming to the layers of the pharynx, from inner to outer, the innermost layer that is the mucosa, okay, that is lined with the epithelium. That is the nasopharynx is lined with a pseudostratified ciliated columnar epithelium. Oropharynx and laryngopharynx is lined with that is the stratified squamous non-keratinized epithelium. Then we'll get the pharyngobasilar fascia. I already told it's extends from this base of the skull to the upper of the superior constrictor muscle. Then we'll get the muscles. Here there is the inner longitudinal and the outer circular muscles. Circular muscles are called the constrictors. Okay. Then over the muscles we'll get this pharyngeal plexus of veins and nerves. Then outermost we'll get the buccopharyngeal fascia. Then coming to this each part of the pharynx. First with the nasopharynx. Okay. So this is the nasal cavity. Leads here. This is the nasopharynx. Extends from this base of the sphenoid bone to the lower part of this soft palate. That pink area. This is the lower part of the soft palate. This is the soft palate. It's made of muscles. Okay. Then in this nasopharynx, okay, in this posterolateral, you can see there is an opening there. See this opening. This opening is the opening of this auditory tube. Okay, that is auditory tube is the tunnel which connects the middle ear to the nasopharynx, which helps to maintain the equilibrium of pressure between the sides of the tympanic membrane. That is pressure inside this middle ear to the pressure outside to the exterior. Okay, for proper vibration actually. Okay, then to the anterior and posterior of this auditory tube opening, you can see there are some mucosal folds. Okay. Those are called the, this anteriorly, that fold is called the, here there is the torus levatorius. See here, this is the torus levatorius. This fold is the torus levatorius. Okay. Posteriorly, that fold here, this is the fold of the salpingopharyngeal muscle. That is the salpingopharyngeal fold. Okay. Superiorly, see here this elevation here. See this elevation. That is the torus tubarius. That is due to the tubal tonsil. Tonsils means there are the collections of this lymphatic tissue. You can see in the subepithelial layer. Okay, that belongs to the mucosa-associated lymphatic tissue. Those groups of these tonsils act as the first line of defense against these pathogens into this nasal cavity and to this digestive tract. Okay. Then, additional to that, okay, these features here behind this salpingopharyngeal fold, okay, behind this salpingopharyngeal fold, you can see a recess space here that is called the pharyngeal recess. Okay. Then, to the superior aspect of the nasopharynx, here we'll get, this is the area for this pharyngeal tonsil. Okay, here this is will get the, here we'll get the tubal tonsil. Here we'll get, this is the pharyngeal tonsil. Okay, those about the features of this nasopharynx. Then here it's already described. Here so oropharynx. See here. So oropharynx extends from the lower part of the soft palate to this upper of this epiglottis, orange shaded area. This is the tongue here, posterior. Okay, this tongue. Here we'll get the palatine tonsil. In the tonsillar fossa, there we'll get, posterior we'll get one mucosal fold. That is the palatopharyngeal arch. Okay, that elevation is due to the palatopharyngeal muscle. Okay, palatopharyngeal muscle is the muscle of this pharynx. Okay. This levator veli palatine, this muscle is the muscle of this soft palate. Okay. So that's about this oropharynx. Then next is the laryngopharynx. Here, this is the epiglottis, this is the thyroid cartilage, this is the cricoid cartilage, laryngeal inlet. Behind this, there is from the upper border of the epiglottis to the lower of this cricoid cartilage. This is the laryngopharynx. Okay. Then here in this coronal view, what you're seeing, that is from the posterior view. Okay, this posterior muscular part is cut, that you're seeing from the posterior view. Here, this is the base of this occipital bone. Here we'll get the posterior nasal aperture. Anterior, it has communication to the nasal cavity. See, this is the soft palate. The central process here, that is called the uvula, which is hanging from the soft palate. See, this is the epiglottis. See the epiglottis. From here to here, this is the laryngopharynx. It continues as the esophagus. Anterior to the esophagus, we'll get this. That is the which one? Trachea. Okay. Then in the posterolateral of this laryngopharynx, see this, there is a space or recess that is called piriform fossa or piriform recess. It's bounded medially. This part is the aryepiglottic fold. Superiorly, we'll get the glossoepiglottic fold. Laterally, we'll get the thyroid membrane that you can see from here. Laterally, we'll get the thyroid membrane. So, piriform fossa or piriform recess is the space which you can see on the posterolateral wall of this laryngopharynx, this area. This is the piriform fossa or recess. Okay. It contains the internal laryngeal nerve, and also it acts as a reservoir for foreign bodies. Okay. So if you want to remove the foreign bodies, one should be careful to avoid injury to this internal laryngeal nerve. So internal laryngeal nerve, the sensor is applied to this inlet of the larynx. Okay. That's all about the divisions of the pharynx. Let's move to the muscles of the pharynx. Okay. So muscles of the pharynx, there is the inner longitudinal muscles. Okay. Then outer circular muscles. Circular muscles are called the constrictors. These are skeletal muscles or the striated muscles. Okay. Here, this is the lateral view. See, this is the lateral view. This is the posterior view. Okay. See, here, constrictors or the circular muscles are the superior constrictor, middle constrictor, and inferior constrictor. See, here we'll get a pterygomandibular raphe extends from the pterygoid process of this sphenoid bone to the mandible. There is a fibrous structure, that is the pterygomandibular raphe. From there, the superior constrictor muscle is coming from both sides. Okay, it's coming from the both sides upwards medially, and is attached to, there is a median ligament that is called the pharyngeal raphe. It's a fibrous structure extends from this pharyngeal tubercle to the entire length of the pharynx at the level of the C6. Okay, that is the pharyngeal raphe. Okay, so that about the origin and insertion of the superior constrictor. Then see, next is the middle constrictor. This is the body of the hyoid bone. This is the greater corner of the hyoid bone. From those two parts, this middle constrictor is coming, see, upwards medially from both sides, and it is attaching to this pharyngeal raphe. See, this is the inferior constrictor. Okay, this is the thyroid cartilage. Here we will get the cricoid cartilage. Muscle fibers arising from this thyroid cartilage form the thyropharynges. Muscle fibers arising from this cricoid cartilage that forms the cricopharynges. Both muscles, cricopharynges, this is the thyropharynges attached to this pharyngeal raphe. Okay, that's about the constrictors. These constrictors act as depressors. Okay, which helps to pulls down the food, that is the bolus. Okay, towards the esophagus. Okay. Then here you can see this, the longitudinal muscles. The longitudinal muscles are the stylopharynges, salpingopharynges, and palatopharynges. See, first we'll see about the stylopharynges. See, here you can see this is the temporal bone. This is the styloid process. From the styloid process, this muscle is coming. See, this is the stylopharynges. It is going between the superior and this middle constrictor. Anterior of the superior and middle constrictor is going to the entire length of this pharynx, and it's attaching to this posterior border of the thyroid cartilage. Okay, here you can see this is the stylopharynges. Okay, from here. Then we'll get the salpingopharynges. See the salpingopharynges. See, this is the cartilaginous part of the auditory tube. From there, its muscle is coming. Okay, it's going towards this oropharynx. Okay. Then next is the palatopharyngeus. See the palatopharyngeus. See, this is the soft palate. From the soft palate it is coming. Okay, aponeurosis of the soft palate. This muscle is the palatopharyngeus. So this is palatopharyngeus. So this is the palatopharyngeus. So this is the salpingopharyngeus. Okay, see, this is the, where is the stylopharyngeus? Okay, see here we'll get, this is the stylopharyngeus. Both the muscles attached, okay, all these three muscles attached to the posterior border of the this cartilage, that is the thyroid cartilage. Okay, that about the attachment of this longitudinal muscles. These act as elevators of this pharynx. Okay, so once the food reaches this oral cavity, okay, here, so the food reaches bolus, it has to go to this oropharynx, then towards this laryngopharynx. Okay, once we swallows, there will be the closing of this nasopharyngeal isthmus by means of the contraction of the palatopharyngeus muscle. Palatopharyngeal muscle is the longitudinal muscle which closes this nasopharyngeal isthmus. Meanwhile, once we swallows, there will be the closing of this inlet of the larynx by means of this epiglottis. Okay, epiglottis closes this inlet. So from here the food bolus goes to this oropharynx, then towards this laryngopharynx, then towards this esophagus. Okay. So this constructors, which one? This act as depressors of the pharynx, which helps to pulls the bolus down towards this pharynx to the esophagus. Okay. Then this longitudinal muscles which act as elevators. Okay, which helps to receive the food. Okay, these are the ones which helps to receive the food. Okay. That's about the muscles of the pharynx and its action. Here, in between the muscles, okay, these constrictors, there are some structures there in between the superior constrictor. Here in between the superior constrictor and middle constrictor, you can see there is a ninth cranial nerve, that is the glossopharyngeal. Between the middle and the inferior constrictor, you can see the internal laryngeal nerve and the superior laryngeal vessels. And then below this inferior constrictor will get the recurrent laryngeal nerve and internal laryngeal vessels. Okay, these laryngeal nerves, these are the branches from the vagus nerve, that is the 10th cranial nerve. Okay. Then coming to this nerve supply, there is a motor supply of the muscles. All the muscles of the pharynx get its supply through this pharyngeal plexus. Pharyngeal plexus consists of pharyngeal branch from the glossopharyngeal vagus, superior laryngeal nerve, and the sympathetic fibers from the superior cervical ganglion. Okay. Except the stylopharyngeus muscle, okay, which muscle is a longitudinal muscle, it's a direct supply through the glossopharyngeal nerve. So nerve supply, motor supply is through the pharyngeal plexus, except stylopharyngeus, that is through the glossopharyngeal nerve. So 9th cranial nerve. Okay. Then next is the Valdez ring. Okay. So here it relates to this nasopharynx and the oropharynx. You can see there are some tonsils. Okay, collection of the tonsils. Okay, there. And superiorly, there is in the nasopharynx, in this posterior-superiorly, you can see there is the pharyngeal tonsil. Okay, each sides will get the, laterally will get the tubal tonsil. Okay, and relates to this oropharynx, okay, antero-inferiorly will get the lingual tonsil, and the laterally will get the paired palatine tonsil. Okay, so these four groups act as the circumferential ring and forms this Valdez ring, which act as the first defense, okay, against this pathogens which enters into this this one respiratory tract and to the digestive tract. Okay, so this is that's all about the Valdez ring. Okay, here in the antero-inferiorly will get the lingual tonsil, laterally will get the palatine tonsil in relates to the oropharynx. Okay, in the posterior-superiorly of the nasopharynx will get the pharyngeal tonsil, laterally will get the tubal tonsils in relates to this nasopharynx. Okay, so enlargement of this pharyngeal tonsil is also called this adenoids. Okay, so usually the pharyngeal tonsil can increase in size during the age between 3 and 8 years. Okay, so inflammations or infections can cause these adenoids, which blocks the respiratory passage. So that time the child complains, child snores and breathes through the that is to the mouth. Okay, that's all about the valve history. So that's about the tonsils. It's a collection of lymphoid tissue. You can see in the subepithelial layer of the mucosa of this nasopharynx and oropharynx. Okay, there pharyngeal tonsil, palatine, lingual, and tubal tonsils there. Okay. Then blood supply of this pharynx. See here, it branches from the external carotid. See, this is the common carotid. This is the internal carotid, and this one is the external carotid. Okay, that is through the ascending pharyngeal artery, ascending pharyngeal direct branch from the external carotid, and through the branches from the facial and lingual and to the maxillary arteries. Okay, that's about the blood supply. Then here is venous drainage. Okay, 3 sets of veins are there. That is from the superior groups of veins. Okay, towards this pterygoid venous plexus. See, towards the pterygoid venous plexus. Middle groups of veins drains into this facial vein. See, this is the facial vein. Then lower groups of this veins drains into this internal jugular vein. Okay. So that's about this venous drainage through the pterygoid plexus, through the facial vein, and through the internal jugular vein. Then lymphatic drainage, here you can see along with this internal jugular vein. Okay, you can see there is the retropharyngeal nodes. See this area, this is the retropharyngeal lymph nodes. Lymphatic drainage mainly to the retropharyngeal nodes. Okay. That's all about the anatomy of the pharynx. Okay, hope you understood. Okay, you should write answer for this question. Okay, in the assignment book. Okay, describe the pharynx. Okay, means first there is the subdivisions and features. Okay, should draw that sagittal view. Okay, should comes the nasopharynx, oropharynx, and laryngopharynx, and the features over there. Okay, then musculature, that about this constrictors, that about the circular muscles and the inner longitudinal muscles. Attachment, it's nerve supply, that the sagittal view and the lateral view diagram is necessary. Okay, then it's nerve supply, it's a motor supply. Okay, so sensory supply of the pharynx, that is this is the nasopharynx. Okay, that is through the branches of this vagus. Okay, that is the laryngopharynx is through the branches of the vagus. That is oropharynx is through the glossopharyngeal nerve. Nasopharynx is through the branches from the trigeminal nerve. That is the sensory supply. Okay, then there is the Valdes ring. Valdes ring, but it is actually the interrupted lymphoid tissue. You can see in relates to this nasopharynx and oropharynx. Okay, which act as the adaptive, which gives adaptive immunity. Okay, should draw the diagram. Okay, and should mention, label those the tonsils. Okay, then next comes this applied anatomy. Okay, the applied anatomy, you should find out which is the common area of the carcinoma of this pharynx. What is tonsillitis? Okay, what is tonsillectomy? Okay, then add something about this adenoids also. Okay, thank you.